And we are live. Hello, everybody. Good
Hi.
morning. This is Dr. Din, and I am here with our hair guru.
Good morning. Hope
This is
everybody's well.
Laura, our hair guru, and we are here from the home office. And what a very very important question today is about hair. And the reason hi Ahmed, how are you? Well, Ahmed, this is a very important thing for you today because we're talking about hair loss and why it happens and how we can prevent some of the hair loss, because right now a lot of people are suffering from anxiety, and as we all know, anxiety can sometimes lead to further hair loss.
Well,
And
also, right, the hair loss because your body is anxious, especially going through what we're going through. So
yes,
explain, because you said to me,
Yep.
your body takes from.
yes, yes. So basically, I was telling Laura what are different things and why do we start losing hair? And the thing is that the body does not think that hair is that important, especially when you're going through anxiety phase or some kind of a problem or whatever. So if, for instance, if you're anemic, or if you're just anxious or something, your body is going to take the resources from the hair because it doesn't think that hair needs you need hair to survive. So therefore, it just takes the resources and uses it towards other functions. So one of the ways for hair loss not to happen is to make sure that you you somehow manage your anxiety. We do definitely tell people to also go and get their blood works done. Anybody who comes to my office complaining of hair loss and everything, we always tell them to just make sure that they are very clearly taking care of their health, because we're also a primary care doctor's office. So we check all your hormones. We check your FSH, which is your ovarian hormones. Hi Kulsum, hi Stuart, hi Zara. Good morning. Thank you for joining. We're talking about hair loss, especially in women, especially because of anxiety. It is extremely important to look after our hair, especially in a pandemic when we are all sitting at home anxious about our businesses and everything. I mean, I am, but still, so one of the things that I also these days I'm telling people. Hi Mercy. So one of the things, how do you know how to tell if your hair is Hi, Zara. Thank you. You're gorgeous too. So what happens is that one of the ways to tell is to brush your hair, and I'm going to demonstrate how I like to do it. But how to tell that your hair is falling a little more than usual. So that is something that you do like almost on a monthly or every 2-3 month basis. Basically, you just brush through your hair and then you count the hair. How many hair you have to actually count the fallen hair. It's like crazy, but you gotta,
But I think you know what? But I honestly, I think that, we all shed hair.
Yeah. But you don't want to
No.
shed too much hair.
Right, but what's.
Yeah. So see, what I do is that I'm gonna bring you guys a little closer, and then you can see. So this is basically hair loss thing. So basically, hi Selena, hi Rosemary. So basically, you would wash. This is just a regular brush. It's clean. I'm gonna just gently comb through it. My hair is dry. I showered yesterday. I didn't shower today. Otherwise, she would have done my hair. And I'm just combing through my hair. And here. And see, this is now my hair. So I can see, yes, some hair definitely have come out. I'm going to take out all these hair that have come out, and I'm going to count them.
Wow, you have like hardly any hair loss.
That's
good.
This is, but the thing is that if you count in the morning, so all the broken strands
Right.
and stuff. So basically, yes, I have so here, so see, some hair has fallen.
Yes.
So
but
but this is nothing. So basically, what I would show you is that if like I'm gonna take this phone out and then I will show. This is so some hair has fallen out. See,
really
and this
good.
is like, you know, so usually like if you have hair loss, you're gonna start counting the hair. You have to like, and then sometimes also count the edge of the hair. So sometimes it is good to see the edge of the hair because you can see basically how many strands are like coming out of the root. So you should check out the root of the hair, and it is a little difficult to see right now. So basically, if you are losing like around 200 hair, that is up to 200 hair with a brush of hair is normal. But if you feel that there's more and more hair is beginning to fall, then you gotta do something about it.
Yes,
hi Michelle, hi Shamuna, hi Savita, how are you? So anyway, we're talking about the hair. So one of the first things that we do in my office, if somebody complains of thinning hair, and especially this part, the front of our forehead, especially in women, we do experience thinning, especially when we start becoming menopausal or in our late 40s or 50s or with stress. It will cause hair thinning. And then what do you do with that? You know, so basically we say do some vitamins, control your anxiety if it is anxiety that's causing the hair loss. What else? One of the things that we also like to do is called we do PRP, which is stem cells, and stem cells are really good also, but not everybody can afford it. But vitamins, everybody can afford it. We also give like a little bit of Rogaine solution.
And honestly, I'm going to tell you another thing that people don't want to listen to, but it's also a simple fix of your diet.
Yes.
Women do not eat enough protein. 3 to 4 grams of protein with every meal. That will help your hair.
That's a very good point. So a good diet and exercise is extremely important for hair maintenance. So one of the things that I will quickly also show you is like what is a way to control your anxiety. And this is something that happened to Laura today. She was like telling me that she got anxious. And here is somebody who regularly exercises, regularly meditates, regularly takes care. Like she's so much into her body and maintaining the way we are functioning, and it's functioning. And still, because of so many things that are happening around us these days, it is absolutely possible to become really anxious. Yes, she's losing.
Lost it. I have, but
exactly. So I had to. So many times, this is the time when you need friends and you need close associates and stuff who can actually pick you up, because there will be days that I will be down and I will need her to tell me, hey, you know, did you do your breathing exercises? So one of the things that I like to do is to teach people how to do breathing exercises. Breathing exercises are extremely important for basically anxiety management and also panic attacks. And these days, with so much happening around us, and you don't want to be on medication for every small thing. So breathing exercises for anxiety management becomes a routine thing to do and are very, very important. Yeah. So today I'm going to demonstrate, and I'll ask Laura to demonstrate some breathing exercises for us, which are basically, hi Digna, hi, how are you? Thank you for watching. Hi Henna, hi Shanaz. Hi Nelson, thank you for watching. So basically we are talking about, we already talked about the hair loss and how to manage some hair loss by eating well, by taking some vitamins. People also ask me what kind of vitamins they should be taking, and I say, hey, you know, you should be taking a lot of B vitamins. Everybody talks about biotin, but biotin is like only a small component of what your hair follicle needs. You do need a lot of vitamin B vitamins, and also vitamin C is really important. I also give glutathione to people, which are really, really good. So again, so this was our hair loss prevention. Again, make sure if you are losing more hair, you should be calling your doctor, and you should be like, hey, I think I'm thinning. And what should your doctor do first? They should actually check all your blood works. Your blood works need to be checked. Your hormones need to be checked. Your hemoglobin needs to be checked, because if you're anemic, your body is not going to spend too many resources on the hair, because that's not going to work out.
We're gonna talk about the breathing.
So let's do the breathing exercises. So for anxiety and panic attacks. So
yes.
Laura, do you remember breathing exercises that you used to do? Were you trained for about when you were giving birth? The Lamaze breathing?
I don't remember.
Okay, so Lamaze breathing is like diaphragmatic breathing. So basically, one of the ways to tell if you are breathing from your belly, which is diaphragmatic breathing, is to put your hands over here. Your hands should move. Your hands should move. Remember, it's coming back to you. So a lot of people call this kind of breathing a lot of different kinds of breathing, because this is Lamaze breathing. It is pretty much everybody knows, and any woman who has given birth should know Lamaze, because we teach it to everybody. It really gives you oxygen, especially when you're going through distress. And right now, a lot of us are going through mental, and sometimes even, there's so many things are happening. People are losing jobs. They're getting sick, and most of the illnesses are respiratory. So breathing exercises are free. You can do anywhere, and you don't have to depend on a medication, because guess what? Our supply chains are breaking, and you may not get the Xanax that is needed for your anxiety management at some point. So what are you going to do? So at that point, you're going to basically depend on your own self, and you're going to learn to breathe on your own, and you're going to learn to calm your own self down. And that one of very easy and reliable ways of helping yourself calm your anxiety down is to not only learn regularly how to meditate, but also how to breathe, because many times when we are anxious, we forget to breathe. So Laura is going to demonstrate some breathing. So usually the Lamaze I would do for 1 to 2 minutes. Mm-hmm. That is a very good. Before I do the Lamaze, I try to stretch my shoulders. We do like a chicken wing exercises, so to stretch the intercostal muscles here. We also do a little bit of these exercises, which is where you breathe in, bring your hands out, and then breathe out. Breathe in inside, and then breathe out. That also basically gives you a lot of release in the intercostal muscles, and that basically allows you and prepares you for the Lamaze breathing, which you should do for a minute or two. When you do the Lamaze for a minute or two, you will automatically see how your body suddenly starts feeling better, because guess what? Every cell of our body needs oxygen. So when you give yourself, and what happens in anxiety? We don't breathe, and then that is what causes further issues, because it just one thing leads to the next. So again, if you are worried about your hair loss, and then you become anxious, and then you cannot manage your anxiety, it will cause a vicious cycle where you will lose more hair, and then you will have more anxiety. So one of the ways to stop it is to start taking care of yourself and managing your anxiety on your own without really using too many pharmaceutical medications. And basically one way to do it is to basically master breathing for yourself, and do breathing exercises every day, do meditation every day, eat well, as Laura said, hydrate.
Absolutely. Yeah.
And then, we Laura would tell you, my office does a lot of IV vitamin infusions, but we're sold out. So what are you going to do? Plus, these infusions are really, really expensive. Actually, over the next year, they're saying that because there is so much short supply, even we cannot get it anymore. There is so much short supply. The same vitamin infusion that we used to sell for $450, $500, or whatever, it's going to be like what? Like over $1,000, $2,000, because nobody will be able to get it. So in the meantime, you can do a bunch of things on your own, like eat well, sleep well, hydrate, take some oral vitamins, and see if, whatever you can. And I also said that if you cannot find, and protein, she's like, we are so deficient chronically in protein. And again, if you start losing patches of hair, then of course you have to go to your dermatologist. And what would your dermatologist do? They'll basically do a very, very wide panel of blood works where they will check your to see if you're anemic or not. They will check all your hormones, your follicle stimulating hormone, your luteinizing hormone, your testosterone levels. They will check your liver function. So they do a lot of these tests to actually see what is the condition that your hair follicle is living in. And that's it. Be well, friends, and be safe. But don't forget to live your lives, because we have to be safe, but we also have to live our lives to the best of our ability, and also continue to take care of our bodies as naturally as possible.
Yes.
As routinely and consistently as possible, because all of these things are all about consistency. You cannot go to the gym, just like when people go to the gym one day and they work out 4 hours and they're like, where's my six-pack? Nowhere. You gotta do it every day. If you want to preserve your teeth, you will brush your teeth twice or thrice a day, every single day. Floss it, whatever. You still go to the dentist. Similarly, your body is just like that. You can't just think that once a year when you go to your primary and that person spends 5 minutes with you and says, oh, everything is fine because you don't have any disease. That's not how you maintain your body.
No.
So that is it. I hope everybody's well. We're going to be back next week, and let us know if there are any topics or questions that you would like us to especially talk about. But hair was a very important thing, because I keep getting questions about hair loss, and there are so many people who are actually doing our PRP treatments. Usually we do like 3 to 4 treatments of stem cells on our patients, and before we do the stem cell treatments, we also give them IV infusions so that they have really good quality stem cells to get injected. And usually people start noticing a difference like around the 2nd or 3rd treatment. Again, the stem cell treatments don't last forever. They usually have to be repeated every 1.5 years. The other thing that I would also like to mention is the Rogaine. So Rogaine, when people sometimes put on their hair, it's really good. But the thing is that you have to be consistent. You can't just put Rogaine like once or twice or 1 week or 2 weeks and think that, oh, it didn't really work on me. You gotta like really commit to it for 4 months. So whether you want to grow your eyelashes, or whether you want to grow here, your eyebrow, or whether you want to grow this, it's a 4-month commitment. Nothing happens overnight. And again, this is something that we have to keep working at. And again, so Rogaine is really, really good, but 4 months. You got to keep doing it once in the morning, once at night, and you put like a little bit. But then, because what happens is that a lot of women that I know, I gave them whatever, and we don't just do Rogaine. We like mix a few other hormones also, because we compound it for our patients. So what we do is that I always tell them that you can't just use this bottle for 1 month and then say, all right, oh, it didn't work for me. No, that's not how you do it. You got to do it, commit to it for 4 months, do it right, and then you will see the difference. Take care. Hi, Iram. Hi, hi, Shaheen. You're most welcome, Shaheen. Thank you for watching, and I will see you guys next week. Actually, I will see them earlier, but you will see
Friday.
Laura next Friday.
Bye,
Take
guys.
care. Bye-bye. Be well.